All right, well, good morning, everyone. We'll go ahead and get started. I'm Marissa Smith, and I'm with the University of Minnesota Alumni Association. I want to thank everyone for joining us for today's webinar, Senior Community Living in a COVID World. Today's conversation is going to be really engaging. It's going to help give us an inside view of what senior community living looks like right now during COVID-19 from a panel of experts. The discussion will cover how senior communities have changed since COVID began, how they've adapted practices that have helped improve life for residents and staff, some common misconceptions, and what the future of senior living might look like during this pandemic. But before we begin, I have just a couple of announcements. First, I want to thank the Pillars of Prospect Park, which is the official senior living community of the University of Minnesota Alumni Association, for their partnership in today's webinar. Second, I want to thank our Alumni Association members and donors for making initiatives like the Alumni Webinar Series possible. If you're interested in learning more about the Alumni Association, you can visit the link on your screen. Next, we have a couple of other upcoming virtual events that you might be interested in. On August 3rd, our Multicultural Alumni Network is hosting a panel of BIPOC business owners talking about supporting BIPOC businesses during this time. And on August 6th, we're partnering with the University of Minnesota Duluth to bring you a behind-the-scenes tour of the Minnesota Landscape Arboretum. So I'll include links to both of those events in our follow-up email today, but you can also find more information at the link on your screen. Finally, before we start the discussion, just a couple of notes about how to use Zoom. So most likely you've joined on your computer's audio, which is great. If you do have the option to listen over the phone if you prefer, and there's information about the dial-in instructions on your screen and also in the confirmation email that you received before today's webinar. The panelists have prepared some great questions, but you are welcome to submit questions as well using the Q&A button, and we will reserve a little bit of time at the end of the conversation to address some of your questions. And then the recording for today's conversation will be available to you all via email after today's webinar. This is my last slide, so we won't share slides, but we will make the recording available. So at this time, I'm going to turn it over to our panel moderator, Shannon Rusk. Shannon is an alumna of the University of Minnesota and the Senior Vice President of Development at Oppidan, the property development firm for the Pillars of Prospect Park. So Shannon, please take it away. I will unmute us all.
Did that work?
Yep.
Okay, I'm unmuted. Thank you, Marissa. I would like to introduce the panelists. We have a really well-versed panel here for all of you today as it relates to the subject of senior living in today's environment. First panelist is Joe Ryan, who is the CEO, founder, and owner of Oppidan Investment Company. Our second panelist is John Lundberg, who is a U of M 1980 graduate, CLA, younger than me, it looks like. President.
I was going to say the year, but.
Yeah, sorry, no. I shouldn't have done that. President of Fairview Senior Services and president of Ebenezer. Dr. Joe Gaugler, our third panelist, is a Robert L. Kane Endowed Chair in Long-Term Care and Aging in the Division of Health Policy and Management at the School of Public Health at the University of Minnesota. And our fourth panelist is Erin Hilligan, who is the Vice President of Operations at Ebenezer. So I would like to launch right in because we have a lot of really good information into the first question that I'm going to send out to the panelists here. So when COVID became real here in Minnesota, let's call it mid-March, what happened in senior living? And I know there are a lot of things and you probably all have something to say, but Erin, do you want to start out?
Sure. So hi, everybody. Thanks for joining us today. Great topic and glad to share our story. I think we were all watching in the United States as the virus was heading to us. We saw what was happening in other parts of the country, and we knew Minnesota was going to probably see it. We had no idea when it was going to happen or how it was going to happen. But eventually it did, and it was right around St. Patrick's Day, if you recall. And it was the state made an order of staying at home. But at the same time, CMS, which is our federal government, as well as the Minnesota Department of Health, started sharing information. At that time, there wasn't a lot of great information about how the virus would affect seniors as well as everybody else. But we care for seniors at Ebenezer, and we needed to find out what was going to happen. Being part of M Health Fairview, Ebenezer is the senior division within that, we really had to rally. And I think it's kind of like anytime there is an emergency, you have to get organized. And I think that's the first thing we had to do is get organized. And we created our huddles that we had. We had to look at what it needed to get done. And we looked at building out a special TCU, which would be transitional care. The health system added a hospital, Bethesda Hospital. We started really figuring out what we needed to do. So when the executive orders started to come in from the Minnesota Department of Health, as well as the federal government, we were prepared. We were looking at what we needed for our PPE, our protective equipment for our staff. We needed to figure out, what if our staff got sick? How would we help them? And what are we gonna do if it enters a building? So that's kind of what happened and started in March. Things that we did is we shut down visitation. It was really difficult. Being in operations, my job really, I feel like, is taking resident safety as part of my work. And then another piece is organizationally, the financial part of our business, and then also the regulatory aspects and balancing all of those. But truthfully, in those three legs of the stool, the resident safety is what drove most of our decisions, along with the guidance and as well as our business operations. So things that we had to do right away was stop visitors, and that was really difficult, and it still is difficult. I'll talk about that in a second. But then we started screening our staff coming in, temping them. We went to universal face masks pretty much right away. A couple weeks later, we went to face shields. My own opinion is face shields are a great form of equipment, and we've seen great success with both of those being utilized. We also added testing. We've been very lucky at Ebenezer to have the partner of M Health Fairview. There is not a statewide testing strategy at this point. We do have the National Guard that's helping, but we've always done a step above that next thing. And so getting in and figuring out where the virus was, there's a lot of asymptomatic people, and really identifying them earlier seemed to be a huge change, a game changer for us. So along with screening and temping and masks and face shields, we stopped also doing communal dining. We also stopped large group activities. We stopped tours. A lot of things that kind of make our communities what they are, we really shut down to try to get organized and make sure that we did everything we could. I always say there's not a vaccination for this virus, but we have PPE and we have testing. And those are our two #1 things that we can do to combat the virus. So with those things, we kind of started looking ahead. We added, cleaning, different cleaning aspects and making sure we're using the right kinds of disinfectants. We continued our testing and we still are using surveillance. We work with our occupational health department very closely on our employees' safety. So we're lucky that we have those resources. We really upped our game around communication with families and residents through newsletters and information even to our owners that we're working with on what we were doing, so there wasn't any questions. We're pretty transparent with our information, so I think that really helps people to understand. We have our huddles every day. Like I said, we were huddling 3 times a day almost. It would cascade down. Fairview leadership had a huddle, then we would have one at our site, and then we also would huddle with our site leaders. So this is what I'm saying is it's not like one person, it really takes all of us together. People ask me sometimes, like, how is it going? How are you doing? And I always say, it's really been hard work. Nothing I could really have imagined. And at the same time, I work with the most amazing people, and I can't imagine doing this with anybody else, and the resources and what we've had to combat the virus. And we're proud of our numbers of our what is the word, John, the infection rate, whatever, of our over 9,000 seniors. We're at about a 1.7% that we've seen in our communities. So we've really worked hard to keep it out, and our recovery rate is also much higher than the average, over 75%. And so when we have seen it come into our communities, we've really worked hard to work on cohorting and keeping it out. And I'm really proud of that, but we had to do a lot of hard work, and there's a balance between shutting down and isolation, and now we're starting to kind of move into that next category of having outdoor visits, looking at our essential caregivers, and continuing our testing. So that's a lot of information to start with, but I think that kind of sets the stage of what happened in March, and here we are at the end of July. A lot's happened in those times.
Yeah. Yeah, and I might just add to your comments there, Erin, and you touched on this, certainly, is that none of us have lived through a pandemic before, and or have understood or realized some of the things that we would be dealing with or managing. So there was in the beginning, and continues to be, still today, some learnings along the way of what is working, what's not working, different approaches for different things, new learnings about how the infection progresses, et cetera, et cetera. And so it's just been really important for us to have various stop points along the way to assess what we know, what we're learning, what's different today than what it was yesterday, and how do we then capture that information to carry forward and inform what we're doing and how we're approaching different things. So it's been very fluid, and it continues to be very fluid as we proceed into the coming weeks and months.
I think we're pretty lucky that we've been able to work with the testing committee. That's all part of mHealth Fairview, and being part of that, as well as the infection control support that we've had. And I think about all the resources we've had and putting all those people together. Mm-hmm. It really has been made a difference, I believe.
Yeah.
Great. Any other comments on that? Operations and the senior world today. I'm going to switch gears a little bit from operations then, and I'll address this one to Joe Ryan. So Joe, as an owner of senior living communities, how have you had to change your mindset and the goals due to the impacts of COVID as it relates to ownership and development?
Good morning, everybody. That's a loaded question. As Erin pointed out, this came fast and furious. And I thought back on 08 and 09 when we had a recession in this country, and it steamrolled all of us, and we were right in the middle of it. From that point in time going forward, it was all about getting ready for the next one. When's the next recession going to come, and how are we best to able to manage the next downturn? No expectation for what came to us in this COVID-19 event. And at Oppidan, we pride ourselves on having a heart and a soul, and certainly in this industry, we get into the senior housing industry, and that's first and foremost. So what's changed for us? No real change, except for the heart got bigger and the soul got deeper. And that's something that we take pride in and has required us to really put forward into our communities. We're a for-profit company. We drive returns, we drive profits. It's return on cost, return on investment, IRRs, 5-year plans, 1-year plans, 2-year plans. And that all went out the window on St. Patrick's Day as we were planning on looking at a new community in another part of the country. And I was on my way out and my son came in, who heads up our HR, and said, no more travel. This thing's real. Shut her down. And we did. And the game changed significantly. Our focus became one thing: take care of two parts of our business, the residents and the frontline, the associates who take care of the residents. And how do we keep our residents healthy, and how do we keep our associates healthy? And our upbringing was this: just had to do the right thing. Regular testing that Erin suggested. We incented the staff, the associates, to stay healthy outside of work, and to make sure that we could keep our residents healthy inside our communities. You mentioned the affiliation Ebenezer has with mHealth, and that was critical to us. The import of our operating partner, Ebenezer, we've always believed anyone can build these things, but it's all about the operating partner. And the Ebenezer partnership that we enjoy became magnified in an event like this. Our team is very ingrained with Ebenezer, and we are very transparent with them, they with us, and that just continued to be magnified throughout this time. And we had to be fast. We had to make decisions quickly. We didn't have time to really plan or see the financial impacts. It wasn't about that anymore. It was how do you take care of the residents, how do you take care of the staff and the associates. And I look at our what the initial slide talked about Prospect Park, and I see how Ebenezer, mHealth, Oppidan, and the affiliation with the university, with the athletic department, the alumni association, through this whole thing, came to finish Prospect Park, open Prospect Park, and that's a 280 unit community with 100 child daycare affiliated with it. And we brought that online, and we did that because of the partnership and the team that we put in place. So team has never been more important. We communicated, we listened, and we worked together. And the change that we will take forward from this, the positive that we have realized is we got to work together. We got to listen. Ebenezer and their team are the smartest in terms of care. We can build them, and together we can do great things. And Erin, you mentioned the success that you've had amongst your peers, and boy, we're so proud of that, and that's real. And that's something that we pride ourselves in our partnership is the issue about PPE and about testing and the inability to get that done. This is not a game for undercapitalized, inexperienced operators. This is for the big boys. This is the real deal, and Ebenezer's done a great job in that regard. So paying attention to the operation every day and staying focused on the two important people, the resident and the associates.
Yeah.
So yeah, I'd like to share some thoughts here, maybe from a little different perspective. You know, again, coming at this more from a research standpoint, and maybe stepping back even from Prospect Park a little bit and Ebenezer, both of which I have great respect for. Longtime collaborator, partner with Ebenezer, of course. I've known John for many years. So we have two large national studies that are going on right now. One is a study where we're providing support to family members of loved ones with dementia who live in residential long-term care settings, nursing homes or assisted living. And then the second study we have is actually a study of adult day services throughout the US. And in both studies, we focus very strongly on family caregivers of people living with dementia in both sets of studies, in terms of surveys, interviewing, delivering services to, et cetera. And, you know, I see COVID-19 through their eyes in some ways, because that is who we're hearing from the most and have been hearing from the most since March. A really great sense of anguish, frustration of what's been going on, kind of feeling that, you know, they can't be as involved or engaged with their loved ones living with dementia as they have been before. And some of these are for very much public health reasons, not being able to visit, for example, to remain engaged, et cetera. And when I think of COVID-19 and what it means for senior living and housing, and really from a larger standpoint of long-term care, when I think of long-term care, I think beyond residential settings. I mean, I think of long-term care as being delivered at home in partnership, say, with community-based long-term care services like adult day programs, to actual residential long-term care. And what COVID-19 has shown, and I think demonstrated, unfortunately, is how, I guess, shattered, and there's a lack of fragmentation across these different sources of long-term care in the US. When I look at many residential long-term care settings, I've been very dismayed when I read the media newspaper articles that really kind of has been a knee-jerk bash to the nursing home kind of approach, when in fact the context, I think, is much more complicated. Nursing homes, by and large, have not been financed or supported to the extent where they can or would be expected to manage an infection, a national infection pandemic like we're seeing with COVID. And layered on top of that is some of the underlying issues in residential long-term care that have been there a long time. For example, shortage in the geriatric workforce. And then when you add on to that things like adult day programs, which quite frankly were just shut down. They weren't even allowed to operate. They were just closed starting in March. What that does to many families who are out there and often rely on these services and able to, in order to sustain at-home care. So when I think of COVID and I think of senior living, I mean, stepping back, it's really should lead to a rethink, either at the policy level or an operational level or whatever level, of understanding how these different elements work together in order to provide high quality, person-centered care to people older persons living with various types of conditions. And right now what COVID did is in a way really showed very brightly how, quite frankly, we haven't come even close to being able to integrate across these different sources of long-term care effectively.
Yeah.
And how can we overcome that? How can we address that? Those are the main questions I have coming out of this. And, reading some of the question and answers here on Zoom, Beverly here basically states, my 89-year-old mother has dementia and is in a memory care unit in a nursing home in Minneapolis. Her cognitive abilities have drastically gone downhill, but I can't even talk to her through a window as she is on the 3rd floor. And Beverly, I mean, I literally get emails and messages like this on a weekly basis from our caregivers, other participants in our study. And it's very unfortunate. And at the same time, it should be a call of action for all of us to really rethink about how can we unify these various facets of long-term care to provide, again, more effective assistance and care to older persons who need it.
Yeah, Joe, I absolutely agree with what you're saying there. And this is, a little later in the conversation here, I think, we've got some comments to share about, things we've learned and how operations may be different in the future, et cetera. But I think in general, we all have to be able to step back and identify the learnings of the time that we've lived through the pandemic and use that as a vehicle to reassess whether that's public policy or other related kinds of things, and how we should be operating going forward to address all of the various kinds of issues and comments that you're making, and how do we look at the full continuum of the long-term care or post-acute services and how they tie together, and how we can create the best kinds of outcomes for older persons in our communities.
Right. And we'll talk about the future changes and things that are in place. I want to switch gears just a little bit again. So we're hearing about COVID in the senior living communities, and it's been in the news. I mean, it's front and center. It's been there almost daily. Better news lately, and I'll let you guys talk about that. But what are some of the misconceptions that you hear in the media regarding COVID impacts in senior living, and where are we going with this? And I'm sure you all have something to say on that. I don't know if Joe, Ryan, you pop back on, you want to start with that?
Sure, I'll kick it off. As we were preparing for this, I was coached by Shannon and Michelle to not say anything stupid in regards to this comment. So I'm going to do my best. I was reading my devotional this morning, and it led with, is there any good news? And I chuckled thinking about today. Let's be clear. The fact of the matter is that the long-term care facilities, they're for older people, and older people are the most impacted. And it's a sad situation with the number of deaths that have occurred across the board. And one would only get to the point that many of those would be in the long-term care. That's where the seniors and the compromised, many compromised are living. So the facts are the facts. The way it's been handled is unfortunate, because as Joe mentioned and John followed, we need to learn from it. We need to figure out how to get better, and we need to express it in an appropriate manner. These are living communities. These aren't nursing homes. These are living communities. And the broad brush that was passed across everybody was significant. and so negative. And there's some positives. I live it. We're building them. We're owning them. We partner with a great team, and I've got family that Ebenezer is taken care of for us. So I see it on both sides. There's many positives. How they've handled themselves in terms of trying to minimize the isolation impact, which is so significant. Creativity that they've had to drive to keep their lives better and open and more enjoyable. They've done a phenomenal job that way. And these are stories that should be told. You know, we're hosting here in the near term a jazz festival that we have sponsored in non-COVID times. We're doing that on a jazz festival on wheels. You know, how wonderful is that to bring that into the communities? But these are stories that should be told, and unfortunately they're not, because there's many. As I said, the strong are doing a heck of a job, and Erin mentioned the results. And this team is a great example. And I see how Ebenezer has worked. John in particular in his weekly newsletter talks amongst his peers and how they come together and they're working towards the positive outcomes, and that needs to be spoken about. So the bad press, unfortunate, but it's unfortunately is fraught across all aspects of our daily life. I'll leave it there.
Mm-hmm.
Can I jump in, Shannon? Kind of partnering off of what Joe said. I think one of the untold stories, and I think it's a little unfortunate in newspaper articles that you might see, the story that's not being told is about the caregivers that are showing up every day. I can't tell you how proud I am, but literally how fast we had to ask them to change their work, whether it's using gowns, face shields, masks. For a business, is not really a business, but for our work, that's all about relationships and service and being close and touching. It's all part of our work. All of a sudden that changed. And our number one thing became, how do we keep the virus out, and how do we make sure the residents and the clients are protected? Dr. Gaugler's right, the adult day program shut down. I mean, things just happened very quickly. And I think about the caregivers that showed up every day. There wasn't a lot of articles on that, talking about the number of caregivers that came every day and still do every day. And actually we're continuing to hire. Our retention has stabilized. These are people that are truly coming to work as heroes every day and doing everything they can to make it the best in a very difficult situation in a pandemic that we know is detrimental to seniors. So I think that's the story. If I could tell any story, I could go to every single one of our 50-some communities, and there's just caregiver after caregiver after caregiver that show up every day. That's the story I wish we could get out, that people would hear, because I think it's an amazing story.
Yeah, I want to add on to that. I'm sorry, John, I didn't mean to interrupt.
No, go ahead.
I just want to add on to that a little bit. Is there's no doubt that the direct care workers at Prospect Park and Ebenezer, and really across the various long-term care providers, are heroes. I think, and I think the families or other individuals who are providing help, not just family members but others in the community, are heroes too. That being said, again, I mean, I'm coming back to this point because I just feel like COVID has shown how long-term care is de-emphasized in healthcare, I think, in the U.S. How, again, when compared to, say, hospitals or acute care delivery systems, long-term care delivery systems are on the lower tier in terms of how they're thought of, both by the public, by policymakers, by, quite frankly, payers. Mm-hmm. And so you see the results of that when you have a really an unprecedented crisis like we have now, both in terms of residential care settings, but then again, when looking at these community-based long-term care settings. I mean, again, adult day programs were shut down because they were quote unquote deemed non-essential. And I always wondered, well, who deemed them non-essential? Certainly the family members who are using them don't deem them non-essential. Right, I'm pretty much certain that the clients don't deem them non-essential. Who made that decision? Mm-hmm. So again, I think it shows you again of how different elements of the US healthcare system are treated. And because of that, we get problematic outcomes. And, you know, the person who's endowed chair, my endowed chair is named after Bob Kane. This was probably one of his main messages throughout his career he's hammered away at. And, you know, COVID in a way kind of showed him to be right.
Yeah. Yeah. Again, once again, I agree wholeheartedly with you there, Dr. Gaugler. I think, you know, there is no doubt that there have been some really difficult situations that have occurred in the last 4 or 5 months, you know, that have been covered by the media, and those certainly have been unfortunate. But again, it's also important to remember that the vast majority of skilled nursing centers, assisted living communities have not had massive outbreaks or have not had cases of COVID, period. And so the portrayal is that it's you know, rampant throughout all communities, and that's not the case. And I think that is a disservice when it gets portrayed that way. I think you know, it's also the visiting restrictions have been difficult on everybody. And it is not something, I think that there may be a perception that as a provider, you know, we like having visiting restrictions. We appreciate keeping people out of our buildings, et cetera. And that is not the case. The visiting restrictions have been very difficult in terms of how we operate, and in our being able to communicate with families and to maintain ongoing supports and services for staff as well. And you know, we're working to comply with the regulations and the requirements around that, but we're interested in being able to open up visiting restrictions as well. And certainly, you know, we need to be able to do and address some of those things in a smart way, because we also have to balance that with protecting people. But I think that there is a way that some of that can coexist. And it's not something that providers have been resistive to.
You know, John, I'm going to kind of jump in. There's a lot of questions on some of the things that we can do for visitation and, you know, lowering restrictions. Maybe a good time to just expound a little more on. People have a lot of questions on, you know, how do we, like Beverly's question, my mother's on memory care on the 3rd floor, we can't see her.
Sure.
There's probably a myriad of 10 different questions related to when will we be able to start using restrictions, allow socialization. If you guys want to talk a little bit about that, I don't want to get to the end and not address that.
Yeah, so I can maybe start with that, and Erin, you can add in some additional commentary to that. So, you know, again, people may well be aware, particularly if you have somebody in senior housing or skilled nursing, that some of the restrictions are beginning to adjust or loosen up, if you will, here. And the first phase of that was to provide for or allow for outdoor visits. Again, not completely ideal, but to allow for that whole piece. I know that that's how I visit my mother these days, is in outdoor visits and a picnic table outside her senior community. But that has begun in the last couple of weeks that has happened. And now, beginning in the last week or 10 days, there have been some moves to allow for essential caregivers, those family members, friends, personal connections that have provided cares or services for residents, again, in skilled nursing or senior housing over time, that again, they would be able to come back and visit and provide some of those services. Certainly there's restrictions in terms of use of PPE, et cetera, on that. That's the next phase of visitation. I know that the Department of Health is working on what the next subsequent phases might be of loosening those visiting restrictions, and I don't know that I have any necessarily insider information of what those next steps or phases are, but I know that they're looking at and trying to determine what the next phases are. Now, some of this is also very dependent on the community itself. Depends if a community has any active COVID cases, or if they have had active COVID cases, how long ago that has been, and so that may affect visiting restrictions by site. A location's ability to be able to comply with some of the other guidelines may affect how different buildings are implementing some of those loosening restrictions. And so it may be, what may be happening in one community may be different from another. So it is difficult to be able to compare one building to another from that standpoint, just because of some of those uniquenesses. But so there is some beginning of loosening of some of those visitation restrictions. But again, it's not ideal even yet, and hopefully we'll get there soon. So Erin, I don't know if you have additional thoughts or comments.
No, I would say pretty much exactly what you just said. But for the most part, one thing I want people to understand is it's not the providers that are coming up with the requirements. We really work with the Minnesota Department of Health and then CMS, the federal government. So in Minnesota, we are working under that auspice that MDH is giving us guidelines and how we can reopen. So using the outdoor visit or the window visit. Yeah, if you have a loved one on the 3rd floor for a window visit, that doesn't work. But hopefully an outdoor visit does. Essential caregivers coming next, getting those folks that had been primary caregivers with their loved ones coming back into the building and helping that. And I see a lot of the things in the chat and the questions around isolation, and I think we're all worried about that, and making sure we're still doing small groups and getting out. We have an activity huddle. The activities directors in all of our communities get together and share best practices. So we maintain resident engagement. We do, visits via Skype or iPads with families if we can, if they're out of town. But at the same time, as it's getting nicer out, more people want to do visiting. And until there's a broader understanding, and John is exactly right, it will be some sort of regionalization of reopening. But with more cases, especially in other parts of the country right now, I think Minnesota's doing a pretty good job right now, but we don't want to go backwards like Florida or Texas. And I think we're just all watching what's happening in other parts of the country, and so is MDH. So providers are working alongside with MDH and CMS to come up with those guidelines. So I know, we get a lot of questions from families, when are you guys going to change this? And I think we say we're trying to all live within the same guidelines. So.
This might be a good time to talk then about, there's a lot of questions on what are your strategies being used today for testing. You talked on it lightly that you're doing it, maybe give some reassurances as to what you're doing and what you see coming.
Yeah, so let me comment a little bit about what our testing strategy has been. I noticed a couple of questions that have come across on testing as well. So just in general, folks on the webinar may be aware of the fact that back in, my memory serves me correctly, it was mid-May or thereabouts, sometime in May, that the governor came forward and positioned the National Guard to do mass testing across senior communities. That included, again, both skilled nursing and assisted living communities or facilities. And at that time, we chose not to participate in that process. Specifically, a couple of different reasons. We did, and we have collaborated with the National Guard in any of our communities that are outside the 13 county metro area. And the National Guard has done testing in those communities. Within the metro communities, we have, again, fortunately with our relationship with mHealth Fairview, we've had access or built on the access to testing through mHealth. And we conducted then mass testing in all of our communities through the balance of May, completed that probably in the early part of June. And that mass testing meant that we tested all of the residents in our buildings, all of the staff in our buildings. And then we did subsequent follow-ups post those initial mass testings at a 7-day cycle and at a 14-day cycle, just to ensure, one, that the testing was accurate, and two, that if there were positive instances in the building, that we were assured that it had not spread beyond the initial folks that were captured in that testing. Since that time, we've moved to surveillance testing, and we've implemented that program again probably around mid-June, and we're continuing to operate under a surveillance plan. And so what we're doing in that respect is that on a randomized basis, 20% of our staff in each community are tested each week. And we look at randomizing that so we can get a sense of people that are working on different floors or units of the building, people that might be working different shifts, so that we get a good cross-section of folks that are working in that community. But again, that staff testing is done on a weekly basis. And then on an every other week basis, we do 20% of the residents or patients within that given community. And similarly, map whatever that data or information is telling us. So if we identify different positives, or there's information that comes back from those tests that would indicate that it would make sense for us to look at how we if we do some additional testing, then we would do that. So if we felt that there were positive tests that were coming back and we needed to expand the testing to be a unit or a floor or something beyond the 20%, we would look at doing that. It's been I think Erin commented on about this on the beginning, that the testing strategy is one of the really key and important resources that we have out there, tools to be able to manage and deal as effectively as we can with the virus and the spread. So what I can say is that in the last few weeks, we have seen an increase in positive staff tests, but we've not seen that transmission carry through in terms of our resident testing. And part of that would correlate back to other aspects that Erin has, again, already commented on in our use of universal masking and universal use of face shields, that we see that the use of those, particularly those pieces of PPE, are assisting us in addition to that testing. But that's a strategy that we're using. There is not a specific or defined strategy nationally or even locally in terms of a prescriptive, or this is the strategy that all providers should be using. Now, the federal government, just in the last couple of days, has issued some guidance or information about some broader testing specifically in nursing homes, but there still are some gray area in terms of how that will completely unfold and roll out. But it has been focused to nursing homes. It does not include assisted living or expand to other aspects of senior housing.
Great. So what have you learned as we're going through this, as far as the, and you guys have a good handle on operations, the physical plant? I see a lot of questions on what we're doing to make the environments more friendly in the COVID environment, really to then empower and give seniors confidence to make this move into seniors.
So, I mean, I think a lot of things that we've already kind of talked about, even in terms of some of the visitation, et cetera, some of those pieces really inform how we should be looking at and thinking about senior housing, skilled nursing, et cetera, into the future. So, like at any time, whether, we're living through a pandemic or we're just in normal times, we have to constantly be challenging ourselves to say, what would be the new practices or the best practices? How do we continue to evolve and improve whatever it is we're doing? But certainly right now, in the kind of environment that we're in, we need to look at what it is that we're learning and how do we capture that and move it forward. To just enhance operations in general, whether again it's in a pandemic or COVID kind of situation or not. So some of the things that we're looking at, and we've had conversations with our different partners that are looking at different communities, would be how can we create better visiting alternatives. So if we are in situations where we have a shutdown, if you will, what can we do from a physical plant standpoint that would create a safe way for people to be able to visit? Doesn't necessarily mean people will be able to go to mom's apartment or her unit, if you will, but some way to be able to lay eyes on each other, have an effective conversation, but to be able to do that safely. So looking at some things that can be modified or enhanced within a physical plant that could allow that. You know, we've talked about the pre-screening kinds of things that we've had to do, particularly with employees at this point as they come to work. So how do we create a separate entrance for employees, as an example, so we can more effectively screen those folks, be sure that we understand their situation and circumstances before they're entering formally the building or entering in any patient areas, so that we avoid inadvertently exposing people from that standpoint. And similarly, how can we create more effective screening process for other visitors, folks that may be otherwise coming to our communities? You know, there's been a lot of work over the last years around the development of neighborhoods, and I think that's neighborhoods within communities, within assisted living communities, et cetera. And I think it's important to keep looking at that, that aspect, but looking at how those can be self-contained. So if there are situations where there are outbreaks of whatever, whether it's flu or COVID or whatever the issue might be, that there's an ability to more readily isolate and have those be self-contained and have the sources, the resources that they need in those areas, so that there's not creating the contamination of staff going in and out or going back and forth. Looking at the HVAC systems, and are there ways that we can modify those, easily be able to modify them so that we can have negative air pressure, airflow within those, within either given parts of a building or of a building, and that we can, you know, readily make some of those kinds of changes. Do we need to incorporate doffing and donning stations, or the ability to be able to do that? Are there some spaces that we can change so that if we do have, again, need to deploy different infection practices, do we have the areas and the places that staff are going to be able to effectively access that? Do we have sanitation, hygiene settings more prominently around throughout the building? So in hallways or other locations where people can wash their hands, et cetera. And do we have the infrastructure to remain connected into the various virtual systems that have become so important for us today, whether that's virtual connections to remain engaged with families, et cetera, or virtual connections that have been the primary way right now that we've been connecting with providers and other medical resources. So those are some of the kinds of things that are kicking around out there that we're looking at and that we would address in terms of some of the building issues and some of the items that we'll be looking at going forward. And many of those are just good things to do, again, whether or not there's a pandemic or an outbreak of some kind.
Great, thank you. I feel like I should switch over to, we've addressed a lot of the questions along the way, but I'm gonna hit a few of the high level ones that I thought it was interesting. The first question that came out saying, do you see more senior housing offering walkout units? And then there was a question that's sort of related to it, asking how things are going at Prospect Park in the opening really in June in the middle of this pandemic, and how are we doing related to what we expected for seniors moving in. And I guess at the same time, you can talk about the daycare as well. So if you wanna, maybe Erin, you wanna start on that, and Joe, whoever wants to handle that.
Sure, I can start and Joe can join me. So I think what we found out is as things started getting closer to opening and people moving in, the people did get a little bit nervous. And so some people delayed their move-ins, but honestly, quite a few continued their commitment. They were really looking forward to joining the community and came in, and right now we're ahead of projected occupancy. So We just welcomed another person. I think it was today, as a matter of fact. And so people continue to look. It's a beautiful property. The child care, which was really interesting, was a program actually that had been at another location and moved, but we had to go through licensing in the time of pandemic. So licensing was different than we would typically see. And so we ended up doing a video license and did it all over video and email for the most part is how we got licensed there. They will come out and do a site visit at some point, but it was really interesting to do the exit interview. The whole license, everything was done either on a video or with email. So I would say we had to adjust how we hired staff opening the building. That was different. How we did orientation was different for our staff coming in, smaller groups and more one-to-one. But in general, we're ahead of where we expected to be. So I feel feel good about that. I don't know what you would say, Joe, but you know, we figured it out.
Without a question, the lead up to opening was fantastic. It was well choreographed. We did it differently as we were having construction completing and furnishings and so on being put into place. We separated that process and keeping the environment clean and disinfected along the way. But I think the bigger piece of it was that there was transparency in what was going on. No one was ignoring the facts, and we're transparent, and Ebenezer in particular, in terms of our marketing of the product through virtual tours, understanding the concerns of a move, understanding of a family member moving in one of their parents into a community. So the transparency and the communication and the tools that they put in place to allow that to happen peacefully and appropriately was significant. And I think it's the resulting, where we sit in terms of our census just tells the story very, very well.
Great. And we talked on this sort of high level, a lot of questions on mental health, residents, and your staff. Any insights there on where we're at on that and if you're seeing it and managing it?
Yeah, again, something that's been a concern for us from the very beginning in terms of combating the mental health related issues, the depression, loneliness, etc. All the things that have kind of come up in conversation to this point. So what I can tell you is, just the kinds of things that we've done within our organization to try to address that. Certainly there may be other approaches that different organizations have taken. But we have, from the resident and or patient standpoint, we have really the programmatic and activity staff have really tried to push the envelope as much as possible in terms of how of identifying as many things that we can do virtually that people can connect and engage with from their living units and participate in, whether that is the different programs through the McPhail School of Music, other reading programs, a whole host of different types of programs that way. Also looking at other ways that we can provide for programming within the community that is responsive to the distancing kinds of needs and requirements. So, and again, people may have seen or witnessed some of these sorts of things where we've had different programs that take place within a hallway on a given unit where people can be sitting in their doorway where they're distanced from each other, but they can participate in other different programs. We've implemented, for example, some exercise programs that way, because it's also, I noticed a question about that pop up on the chat as well, that we know that it's important that we provide some different ways and things that people can do to maintain strength, et cetera. And so looking at how we can do some of those things in that way, different ways that we can go around the community and connect and engage with people at their apartment, at their unit, that staff can do that, delivering different things to their units. We've had different programs and events that have taken place in the courtyard areas so everybody can participate from their apartment and with, opening windows, etc. But trying to be as creative as we can to address those mental health needs, those socialization needs, etc. And then from the staff standpoint, we have provided for and identified a number of resources for staff to have available different resources through our employee health programs and services, other ways of being able to connect with them. Part of that also has been in the recurring and regular huddles that Erin referred to, remaining connecting, understanding the issues so that we can properly respond and address some of that stuff. Those would be some of the kinds of things that we've done.
Yeah, I would say, we have employee assistance program that has been out and they've been rounding in our buildings. If there's been an outbreak, that's really, honestly, it is stressful for the staff.
Yeah.
So making sure they have those resources. There's also other online or phone numbers they can call and have individual appointments for those individual cases. Our spiritual care department has been very active as well in understanding how to support the caregivers as well as families and residents. So making sure that they're there, especially if there's been a death, unfortunately. It's hard. It's really hard. I won't even try to sugarcoat that. But again, I'm so impressed when people do reach out and say, I think we need extra support here. It feels really heavy. So making sure we rally around those teams and bring in the help and support. Also for people that are sick, if they've gotten sick for whatever reason or are worried about getting sick, there's no judgment on our part. We have created a COVID float team as well for people to come in and help out in the staffing crisis so that we have the extra pairs of hands. As well as redeploying from some of our other parts of the organization, like our adult day programs or other things, people have come in to help. So it is hard. I will say it is hard, but I also think we have resources and support available to people.
And I just add that the respect of the associates and the frontline people that we have for them is significant, and appreciating them. And Ebenezer put out hero shirts and across all the communities. What a great idea. Calling them what they are, they're heroes. And from our chair, we communicate with the frontline people in all of our communities on a written basis, hosting in their break rooms, trying to host them to make them more comfortable, but appreciating them and respecting what they're doing. And that goes so far in today's environment.
So, one thing I wanted to add to those comments there, Mr. Ryan, and, I really wish I had time to address a lot of these questions here because a lot of them are really good. And, to try to synthesize them as best I can in the few minutes we have, I mean, a lot of them are trying to seek solutions. Again, I think it's really easy to bash long-term care as it's currently delivered, and and some of it is warranted. I mean, I won't say that's not true, because it is true in terms of how the service is delivered, how it's financed, etc. But that being said, I do think, and I hope efforts come out of this whole experience where there's been a lot of incredible innovation that's happened on the ground, and I am hoping that we can capture that and rely on that moving ahead and moving forward. And I'm even seeing it in some of the chats here and some of the questions posed. One that really jumped out at me, which was pretty amazing here, was from Jeannie Labor. She says, I was forced to become employed as a PCA in order to continue caring for my 90-year-old mother who has dementia and assisted living. How can we qualify family caregivers as essential healthcare workers and not disqualify them simply because they are unpaid? And that to me is a potential innovation.
Yep.
Thinking differently about families and how they actually interact with the facility. They're not just mere visitors. They play a more important role. And is there some way to classify them so in the future they're not cut off or basically forced to stand outside? Do you know what I mean? It's those kinds of things. And I've heard and read many other different types of innovations that have been happening in terms of engagement. A lot of the engagement has revolved around technology and, how can we use technology to more effectively engage? But I was interviewed in Wisconsin Public Radio a couple months ago, and, you know, I was hearing from families there where they were talking about how can I stay engaged with my loved one living with dementia in residential long-term care. And I was hearing things like some families, they would, there's a way where you can print out like a pillow cover of a picture or names or other things, and you can send it to the loved one, you know, living with dementia. And it's a way to stay more connected, help them have things that, you know, they can relate to. I mean, all these incredible things that people are doing, I hope we can capture them and build on them, because again, it's so important. It's easy to basically point out the problems. What's harder is to develop solutions that we can build upon and can be permanent. And that to me is what I'd like us to strive towards.
You know, we're going to end here, but I think Dr. Gaugler, you ended on a really good comment in that as we're all trying to grab onto the silver linings of COVID, there are things that we have all learned in this industry that we're all a part of that we probably should have been doing before. If we're going to do it now, we're going to do it forever. And so, you know, let's take the things that are good and we're going to get better through all of this. So at any rate, you know, there are a lot of really, really great questions. I think what we'll do is provide online a resource so that the questions, I think we answered a good portion of them, but I know we didn't get to all of them, so I'm very sorry. But we will address them. If you will work with Marissa at the Alumni Association to make sure you've got a point where you can contact us, whether it be Oppidan, Ebenezer, or Dr. Gaugler, and we'll address your questions. We appreciate your time. You were lucky to have this amazing panel to give you their insights, and we thank you all for your time.
Thanks, Shannon.
Thanks, everyone. Appreciate it. Really appreciate the comments too and the questions. It gave me a lot to think about, actually. Very, very interesting points.
Yeah.
Thank you.
Agreed.
Agreed.
Thanks. Take care.
Thank
Thanks,
you so
everyone.
much.
Appreciate it.
Thank you.